Good evening, everyone. Greetings today. I'm Priyanka from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. We all know that taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. If you take care of it, it can help take care of you. This is why it is so important to have a well thought out skincare healthy routine. It is a well known fact that you will feel better when you look better. Having a daily skincare routine helps you to look your best and put your best foot forward when you go out into the world. In today's busy world, cosmetic products are an integral part of daily lifestyle, but are they healthy for your skin? There are steps of skincare that needs to be cleared by an expert. Let's connect today with our skin expert, Dr. Priyanka Sutariya, live Rajkot, to enlighten us on the topic of myths and facts of skincare routine. Dr. Priyanka is a trained cosmetic dermatologist. She has honed her skills by practicing aesthetics such as Apollo VLCC Manipal Hospital. She is an expert in advanced skincare, laser, and surgical dermatology since last 19 years. She completed her graduation from the Swami Medical College in 2001, then specialized in dermatology from MP Shah Medical College, Jamnagar in 2004. She also completed her master's in aesthetic medicine in 2006. Today, Dr. Priyanka Sutariya will share with us on myths and facts of skincare routine. A very warm welcome to you, Dr. Priyanka Sutariya. Hope you are doing good, ma'am.
Thank you so much, and thank you for such a nice introduction. Thank you so much.
We are really looking forward for this session, Dr. Priyanka, as the myths are going to be busted and, a lot of debunk is going to happen. We are going to understand what's right and what's not. So let's begin this session by a very basic thing that people believe, and that is a minimalistic skincare routine is best. Is this a myth or a fact?
It's a fact. So, a minimalistic skincare routine consists of cleansing, toning, moisturizing, and sunscreen in the morning, and cleansing, toning, moisturizing, or a night serum at night. So, that is a minimalistic skincare added with a weekly exfoliation and pack. I'm sorry, I can't hear you. I think there is some problem with the, I can't. So till we get.
Am I audible now?
Yeah, no, it's better.
Okay. So there was some technical
issue. Yes.
Yeah. So now you have made it clear minimalist skincare routine and what the routine should be, right? Another thing people believe is drinking your skin hydrated. What do you think?
It's a fact. So hydration, whether it is form of pure water, whether it is form of detox water, any kind of water, so at least 2 to 3 liters a day has to be taken, and then it depends upon your lifestyle, maybe more, not less.
Right. So water keeps our skin hydrated. And the order you apply your skincare products doesn't matter, because many people say it doesn't matter, whatever order you apply.
No, it is like I said, it is called as CTMS. So it's very easy to remember. It's always cleansing, toning, moisturizing, sunscreen, and cleansing, toning, serum at night. So the order has to be that. Sunscreen is always the last product on your face.
And as you emphasis on sunscreen, another myth is that there's no need for sunscreen during monsoon or winter.
Actually, I have done sessions just on sunscreen because there are like hundreds of myths. Myth number 1, I am a housewife, I don't want to use sunscreen, I am indoors, I don't want to use a sunscreen. Anyone of any age, right from the age of 2 years, needs a sunscreen. The SPF, I'll discuss it later, depends upon your profession, and we are getting protected from the UV rays. So UV rays means light. So whether it's monsoon or whether it is winter, whether you are on a height, you have to use a sunscreen. Actually monsoon, the radiation is more powerful because it the cloud, basically, you can imagine it radiates it more. So technically you need quite a lot of sunscreen in monsoon also. So it's a myth.
Okay, so another myth busted, there's definitely a need, it's essential to apply sunscreen even during monsoon and winter. And as Dr. explained, the need is more, especially during monsoon. And another myth again with sunscreen. Sunscreen with ultra high SPF ratings provide exponential, better protection.
Right, it's a big myth. So people end up buying 70 SPF and 90 SPF. So basically SPF means sun protection factor. So it tells you how much milligram or ml of sunscreen when you take it and how much protection it will give. So we have to use 30 SPF minimum if you are outdoors, up till 50. If you are using more than 50 in Indian skin, you may even get a bronzing effect. You get a tan. So for Indians, 50 is enough, and you have to take one fingertip. So this much, how much we take the toothpaste, that is to be taken. It is to be applied like a fingertip on the face, neck, ears and back of your neck. So that is how it has to be applied. So 30 is okay, 50 is also okay, but the quantity is more important rather than the SPF. So there is only a difference of 5%. If 30 gives us 90% protection, 50 gives us 95% protection.
Okay, so 30 is good enough. If you are using 40, 50, that's also fine. But beyond that, your work is not like that. There's no point in using higher grades of SPF. Another, again, related to sunscreen. I think with sunscreen, we can do a separate session.
Absolutely.
Related to sunscreen.
I'm a sunscreen pro.
Right. So another myth is wearing sunscreen daily leads to vitamin D deficiency, and this is such a common myth. People, are not using sunscreen just because they believe they'll have
vitamin D deficient. When we are looking at vitamin D intake, not intake, with the help of sun enhancement. So you have to take early morning sun rays. You don't have to cook yourself at 9 or 10 a.m. or 12 noon. So basically, if you want to get your good vitamin D, you have to go to the early morning UV rays. And just putting sunscreen on the face and exposed parts are not going to get you vitamin D deficient. So a 10 to 15 minutes of early morning exposure is required for vitamin D, and taking milk, of course.
Okay, so yeah, early morning vitamin D and milk help. Another myth, you must scrub hard to get rid of blackheads and whiteheads.
Okay, I'll speak in Hindi also if people don't understand. एक्सफोलिएशन मैंने पहले भी बताया था कि एक्सफोलिएशन बहुत लोग डेली करते हैं, बेसन लेते हैं, ओट्स लेते हैं. एक्सफोलिएशन इज वंस अ वीक, फर्स्ट रूल ऑफ थंब. सेकेंड, इट हैज़ टू बी डन प्रेफरेबली इन द इवनिंग, सो दैट क्योंकि हमारे पास पोर्स क्लीन करके ओपन हो गया, फिर हमने उसको कोल्ड से क्लोज मोस्टली या टोनिंग लोग नहीं करते हैं. सो इट हैज़ टू बी इन द इवनिंग. थर्ड, फेशियल एक्सफोलिएटर्स जो रहते हैं, इट हैज़ टू बी सो जेंटल कि व्हेन यू अप्लाई यू शुड नॉट हैव अ हार्श फीलिंग. फेस स्क्रब कर रहे हैं, वी डोंट वांट टू रिमूव द बैरियर्स. सो द जेंटल मेल्टेबल स्क्रब्स आर द बेस्ट, जो घुल जाते हैं. At total no to apricot, walnut, they are basically meant for the body. Coffee scrubs are okay, something which melts, जो आपको ऐसे लगे नहीं, ऐसे फील नहीं होना चाहिए बहुत. So that attend to you can apply the scrub, keep it for 10 minutes, then gentle massage, don't like rub, and then you have to wash it off, followed by a toner or a bath.
Yes, so that's the chronology, that's the order. Another thing is that for oily skin people, especially the myth is you can skip moisturizer if you have oily skin.
Perfect. So there is a difference between moisture and sebum. Moisturizer is the water level of your skin. Oily skin मतलब sebum, जो स्किन के जो ऑयल ग्लैंड्स हैं वो एक्स्ट्रा ऑयल प्रोड्यूस कर रहे हैं. तो अगर हम उसको मॉइस्चराइज नहीं करेंगे, सो द ऑयली स्किन will be more oilier. तो sebum production उसको cover up करने के लिए ज़्यादा होगा. So we use either toner या फिर कुछ भी water और gel based moisturizer, oily skin moisturizer.
Yes, and it's also said that antibacterial soaps are the best way to clean your skin. What's your tip?
So I think we are having all wrong myths. So
myths are supposed to be wrong, and we are here to deep,
right. Again, a wrong myth. There are some normal bacterial flora on the body which protects us. So overuse of anything which will have too much of antibacterials, जो आपको normal bacteria चाहिए वो भी जाएगा. So you rip them off. So ultimately you end up getting more infections. If you remember during COVID, everywhere they told use any soap or any wash. The technique is important.
Yes. Okay. Another thing that you should wash your face as frequently as you can, especially with oily skin. They actually keep on washing their skin as frequently as possible.
So another wrong myth. आप जितना wash करेंगे, the more you wash, there will be a protective mechanism of the body. The more oilier it will get. So you have to wash max 4 times or 3 times a day. One. Every time you wash, don't use water. Just don't splash water. You have to wash it. मतलब with a cleanser. And again, tone. अगर tone करने का time नहीं है, तो wash and put some oil control serum. Something which has zinc, niacinamide, something like that.
Okay, so we have another
myth busted.
Myth busted, yeah. One more thing, doctor. We often say that you should start using anti-aging products in your youth itself. So what's the fact behind anti-aging products? What's the right time to start using them?
For me, anti-aging starts from the age of 28. So basically there are 3 sets. So one is like the 30s, the early 30s, 40s and 50s. So when we are starting in the 20s, the late 20s, so 28 to 35, we use anti-aging serums which have vitamin C. Then comes retinol in the next group, and then comes peptides and collagens. So it is always better to ask your dermat, but yes, you should start from the age of 27, 28.
Right, so the right age to start is 27, 28, 29. Okay, fair enough. Another myth in home remedies specifically, people are using it like crazy. Toothpaste gets rid of pimples.
So basically,
toothpaste are for toothpaste.
So basically, the white toothpaste, it will have zinc. But the zinc is bigger particle. We call it macro. It will actually not penetrate the skin. So वो जो थोड़ा बहुत effect जो आता है drying का या sudden whitening का, it is because of the zinc. But technically it doesn't work. Pimple पे भी lot of people you put Colgate and all that, So it is that zinc what helps temporarily. But you can instead opt for a proper zinc cream or a serum rather than toothpaste, because it may cause burn. The fluoride content high हुआ, gel high हुआ, it may cause a burn rather than helping you.
And people these days are putting everything they can on their pimples, so that actually makes it worse. Popping your lips will make it go away. Another thing.
Actually, when we think of from the medical point of view, your pimple is 8 millimeter down the skin, 8 millimeter. So when it is like a balloon, it's like a cyst. So when you pop it, only 1/3 comes out. Imagine it like a balloon. The rest of the 2/3 bursts inside.
Oh.
So it is like thak. हमने ऊपर से दबाया, नीचे वो फट गया. So that causes the scarring and spreading of the infection. So even we as doctors don't burst them. There are special suction machines which is called as polishing or microdermabrasion, which sucks it out. So you are not supposed to burst it. It will give you temporary result, causing more scarring and damage and infection spread.
पर हमें लगता है हमने इसको but
पॉप
yeah,
कर दिया और उसे निकाल दिया.
निकाल दिया,
Yes,
and
yes.
actually they are making it worse.
Worse, yes.
और इसीलिए कहते हैं कि एक बार आपने pop कर दिया तो फिर the scar is going to stay only, you know,
Yes.
the maximum technology will be able to, you know, make you get rid of those scars. So please don't do it. It's again a big, big, big
Big, big
myth.
myth.
Now, Doctor, because we spoke so much about sunscreen, I think with sunscreen we have like 100 or 200 myths associated, and that's the reason in India, despite the fact that we are living in a very tropical or humid or warm conditions, people are avoiding sunscreen. A study says that 67% of Indian people are still not using sunscreen as their daily skincare routine. Now my question is, people will often say सनस्क्रीन लगाते हैं तो बहुत ऑयली हो जाता है, बहुत स्वेट होता है, इसलिए नहीं लगाते. Your take on that?
See, we have such a good range available now. Like I said, the more SPF it will be, the sunscreen particles have to be in an emulsion, which oily hota hai. So stick to 30, 1. So 30, 35 is very good texture. You have sunscreen right from dry skin, mattifying, silicone gels. You know, you get even water based sprays. तो जो ऑयली स्किन वाले हैं उनके पास एक बहुत अच्छा ऑप्शन रहता है. इवन टिंटेड फॉर विमेन, यू नो, यू कैन, व्हाट आई एम वेयरिंग जस्ट नाउ, इट्स जस्ट अ टिंट, so you feel as if you've put foundation but it's a sunscreen. Second, just give me a sunscreen. The method of application, sunscreen is not supposed to be rubbed. So you know, I'll just tell it very fast. You have to put it like this, and you don't do like this, so it will become oily. So you have to just dab 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 and apply.
Just need to spread it.
Yes, because sunscreen is an emulsion. So the emulsion मतलब water, oil in water. So what happens, अब जैसे आप उसको मसाज करोगे वो oily हो जाएगा. So it has to be dabbed like how we put foundation.
Right.
So we can put that, and that's why we put a serum or something below it, so that जो body का protective mechanism है oil बढ़ाने का, that is little bit settled down.
Okay. I'll also take some of our live viewers' questions. So we have Rekha Cha. Rekha is, ma'am, are cucumbers eliminate bags under our eyes? You know,
Okay, yeah.
under our
So
eyes.
basically, cucumber क्या करता है? It is, we generally keep it in the fridge and apply, so it gives a soothing effect. तो जो डार्क सर्कल्स अगेन इज अ बिग टॉपिक, तो जो ओवर एक्सर्टेड आइज होता है बिकॉज ऑफ द ब्लड फ्लो, उसको वो सूदन आउट करता है, इसलिए वो लाइट कर देता है. सेकेंड, क्यूकम्बर एक्सट्रैक्ट्स हैव अ लाइटनिंग प्रॉपर्टी. येस, यू कैन यूज इट, देयर इज नो हार्म. फ्रेशली कट यू कैन पुट इट, इट्स अ वेरी सूदिंग थिंग, बट ऑलवेज एड समथिंग हाइड्रेटिंग. So for me, dark circles in another 10 minutes job, but yeah, you can use it, not bad.
Okay, and you know, people go with potato slices and tea bags when they have, you know, different dishes, they can use it.
Yeah, all three, they are fine, it's okay.
Okay, and we have Abhilasha asking, lips don't sunburn, it's a fact or not?
Sorry?
Lips, you know, lips don't get burned by...
Yes. See, the most sensitive part of the face is the lower eyelids, which we, when we put a sunscreen, you know, we never put it like this. So it has to be like this. Lip balm with the SPF is a total must. If you are wearing a lipstick, either buy an SPF lipstick or you just top it with a lip balm. And at night, always remove your lipstick with a makeup remover or simple coconut oil, and again a lip balm.
Okay, so that's the way. Shruti Nigam is here asking, is moisturizer the best defense against dry skin?
Yes, the moisturizer is the best defense, but again, which moisturizer, that your dermat decides. For a dry skin, you need hyaluronic and peptides.
I think again a big myth is that people, you know, are not going to dermat, they are going to their, you know, social media influencers or are following
like,
that.
Yes.
Or the chemist wale bhaiya aisa ho gaya, please kuch bata do. So yeah, so again, we'd like to have.
See, I'm sorry, I always tell people in India we are so fortunate that the dermat is one call away. Right. You stay in US, you don't get a derma appointment for like 6 months, you know. Right. So kindly consult your dermat. First, find whether the person is a dermat or not. Look at the degree. One. Right. then visit your dermat. She or she will be the best person to guide you for your queries.
Right. So in case you have any skin-related problem, please go and consult your dermatologist, and he should be a proper dermatologist. Neha Chaudhary is asking, can eating junk food cause zits?
See, basically, zits is, we don't consider zits as a disease. So it's a, uh, it's a disorder which is caused by your bad sleeping habits, bad eating habits. So whenever you eat which has over milks, sugar, cheese and all that, it causes a hyperglycemia जिसकी वजह से वो pimples pop out होते हैं. So overeating of anything junk food is bad. You eat once in 15 days, it's fine. But अगर आप उसी पे जी रहे हैं तो of course it will cause problem. So go more for citrus, lighter foods, higher protein, low carbs, low fats.
Okay. ये कहा जाता है कि मिल्क प्रोडक्ट्स या डेयरी प्रोडक्ट्स भी नहीं लेना चाहिए ज्यादा, नहीं तो उससे भी रिजल्ट्स होते हैं.
अभी क्या हो रहा है कि जो मिल्क प्रोडक्शन इंडिया में हो रहा है 50% इज डन बाय, लॉट ऑफ इट इज डन बाय गिविंग हॉर्मोन्स टू द एनिमल्स व्हिच वाज नॉट देयर 20-30 इयर्स बैक. सो उसी की वजह से पिंपल्स हो रहा है, उसी की वजह से ओबेसिटी हो रहा है, एस्थमा हो रहा है, मेंस्ट्रुअल डिसऑर्डर्स हो रहा है. सो इट्स अ विशियस साइकिल. So what we suggest, we don't stop milk. Take 100 to 150 ml of milk in the morning, fat free, and take more of curd. आप 300 ग्राम ले लो, divide कर दो. Curd, any form is better for your weight as a probiotic, as a skin cleanser, as a gut cleanser, and of course sugar free.
Yeah. So you milk but in very small quantities in the morning, otherwise go for curd. Curd is really like magic. Another very interesting question that Sonia Iyer is asking, eating carrots can make your skin turn orange. Is it true?
No, I think it's a myth. I think, depending on how much it is vitamin A, so it gives you, and beta carotenoids, so it gives you a very nice glow. And vitamin A, but I don't think so. No, it's a...
Yeah, and I can't even imagine how a person with an orange skin looks like.
No, it will not make you orange.
Yeah, so please eat orange, carrots. So to make you orange, but it will actually fulfill your vitamin A, requirement. Charles is asking, ma'am, all your teenagers get acne, is it true?
No, any age you can get acne. It starts right from the age of 12, when it's teenage acne, and then there's something called as senile acne. You can get up till the age of your hormonal changes, till 40-45.
So acne,
food, diet, exercise, meditation, everything.
And eating is
a big thing. Sleep pattern and eating both.
Okay. And come back to our favorite topic of the day,
sunscreen.
And as you also mentioned, the people who are taking say that they don't need, sunscreen. Fact is that people these days are working more from home, they are going out less, and they don't understand why they need sunscreen because they are inside their homes and no sun exposure at all. So how would you like to address this?
So basically the sun, it's about not sun, it is the light exposure. So there is a whole spectrum from UV, A, B, infrared. So the halogen lights, the TV, the computers, the mobile, they radiate infrared IR radiation. Since the last 6-8 years, we get IR sunscreens also for the corporate people, and especially the people who are doing makeup and artists. So आपने बहुत generally देखा होगा जो लोग इसमें रहते हैं beauty industry में, उन लोगों को यहाँ बहुत pigmentation हो जाता है. It is because of one makeup, overuse of makeup. Second, infrared light, hard halogen lights. So दोनों को sunscreen लगाना होता है. खाली आप, if you are a architect, you have to use more of physical sunscreen. You're in the sun whole day, so that's a zinc or a titanium dioxide. अगर आप normal housewife हैं जो बहुत computer work नहीं कर रहे हैं, तो you can use a basic broadband. And if you're a hardcore computer user, then you have to use a UV to IR infrared sunscreen. You get everything.
Like these people are mostly on mobile phones, laptops, etc. So again, for them, those
I
infrared
have
or blue
sunscreens.
light,
Blue light, yes.
sunscreens are also available. So
Yes.
they are good. Okay. We'll take few more questions. Priyanshu, though we have discussed it before, but since Priyanshu is asking, higher the SPF, better the protection. Let me know, ma'am.
uh, 35-50 is fine. The frequency is more important. If you're using a 30-35, you have to apply 4 to 5 hourly if you're outdoors and 6 hourly if you're indoors. 50 sorry, for 50 4 to 5 hourly, and if you're in water or in swimming pool 2 hourly. 30 में थोड़ा खाली आपको frequency बढ़ जाता है, that's it. The protection remains the same. So if you're in house or in office and all that, 30-35 morning afternoon is fine. And if you're shopping and outside, I'll just add into that. Suppose हम लोग घूमने गए हैं, बाहर गए हैं, तो हमें कुछ फेस वॉश करने का नहीं मिल रहा है. Sunscreen is the only product which you can just layer on without washing.
Okay.
You don't need to wash your face. It's a barrier. You can just layer it on. जैसे you're on the beach, so just layer it on. You don't need to wash your face.
So it's like a jacket, it's like an armor for your skin. You need to top up your skin with sunscreen and do it regularly, daily, with whatever frequency or reapplication is required. So you need to do that. Such an biggest question, मैम अगर मॉइस्चराइजर ना लगाएं, अगर मेरी ऑयली स्किन है और मैं मॉइस्चराइजर ना लगाऊं तो क्या हो सकता है?
कुछ होगा नहीं, बट धीरे धीरे आपका पोर साइज बड़ा होता जाएगा, आपको पैची पिगमेंटेशन हो जाएगा. ये वाला जो एरियाज रहता है ऑयली स्किन वालों का नियर द नोज, इट बिकम्स ऑल पैची. सो आप बहुत सीरम्स अवेलेबल है मार्केट में, जिंक, AHA, BHA, अगेन आस्क योर डर्मेट. प्रेफरेबली यूज करिए. कुछ नहीं तो गुलाब जल, यूज अ टोनर, वॉश करके जस्ट यूज अ टोनर, सिंपल टोनर. बट उसको कुछ पानी में जो भी केमिकल्स रहते हैं, जो भी हार्ड वाटर रहता है, जो भी हमारा इम्बैलेंस हुआ है वॉशिंग से, उसको आपको टोन करना ही चाहिए.
Okay, so अगर आप मॉइस्चराइजर नहीं भी लगाना चाहते हैं, but a toner, rose water, such a natural toner we have, you can use that. Sonia Sen is asking, if a product is burning on our face, or have this burning sensation, does it mean it's working?
It will depend upon how much burning is there. If it is stinging, as if lemon लगाया हो तो कैसा feel आता है, then it is still okay, and that should be not more than 10 to 15 seconds.
Okay.
If it is जैसे मिर्ची लगाया हो ऐसा feel होता है, then definitely that product is not for you. I mean, that was the best what I could say. So that's a wrong product. That's a wrong.
I think the parameter should be the sensation is like that of a lemon or that of mirchi. Yeah. And Tika Sharma is asking, how do I know my skin type?
Okay, this is my favorite. I take it in all my talks. Wash your face with a gentle cleanser, something pH balance. Don't do anything for half an hour. Normal, no exercise, nothing, no makeup, nothing. Take a small mirror and उसको forehead पे 30 second press करो. Then again यहाँ 5 zones, 1 2 3 4 5. So if nothing is there on the mirror, it's a normal skin. Okay. If there is oil droplets, then it's a oily skin. If there is flakes, then it's a dry skin.
Okay,
so that is how you come to know your zones.
And if you are still confused, you can also go
meet your doctor.
Yes. Okay, so we have Tanya asking, how can I fix uneven skin tone?
Good diet, hydration, because inner beauty has to be, beauty from within. Then again your proper regime. And uneven skin tone, we also need to find out whether your iron, B12 levels are there or not. And if it is just tanning, then a good vitamin C or AHA, BHA serum, niacinamide, Kozik, that would help. May I add few things here, because I want to speak a lot, but there is a common myth now कि हम डॉक्टर के पास हमारा स्किन खराब है तो ही हम जाएंगे.
Right.
So one, no, consult your dermat, just walk in for a regular skin care. Second, डर्मा ट्रीटमेंट से हमेशा हमारी स्किन की लेयर निकाल देंगे.
हाँ.
Okay, derma procedures will remove one layer of the skin, whether it's peeling, carbon laser, whatever procedures. No, they are doctors, we are doctors, so we enhance, rejuvenate, healthify your skin. When we do a
Hmm.
peeling, they are, uska naam peel hai, but it's a fruit based products, so they remove or detox the dead skin. It will not remove your normal skin. And any derma procedure, you have to wait at least 20 days to see results. So take your time and go accordingly. It takes at
Right.
least 3 skin cycles, that is 3 months, to give you a flawless skin. So give your dermat that much time, please.
Yes, I think that's very important, and we are really glad that you actually, put that forward. So it's important to consult a dermat, even if you don't have any skin-related issues, but you want to go for a regular, checkup. Like we go to any doctor, एक health checkup के लिए भी तो हम जाते हैं. हमें लगता है कि अब बीपी हो गया, एक बार जाके check करा लेते हैं, कहीं बीपी का पेशेंट डायबिटीज. Skin is the largest organ, तो उसको लेके भी हमें ध्यान रखना चाहिए. जो अंदर हो रहा है हमारी बॉडी में, वो एक्चुअली हमारी स्किन पे रिफ्लेक्ट हो रहा है. तो
100%.
डॉक्टर, एक और चीज मैं पूछना चाहूंगी आपसे. जब भी स्किन में कोई प्रॉब्लम होती है तो हम डर्मेट के पास जाने से पहले अपने किचन की तरफ भागते हैं, किचन गार्डन की तरफ भागते हैं. तो लगता है एवरीथिंग एंड एनीथिंग दैट्स देयर इन द किचन फ्रॉम टॉप. आपने उसका बताया भी कि एक्चुअली ओवर एक्सपोजिंग our skin एक्सेट्रा, या फिर जल जाने के हाथ से लेके लगाते हैं. तो ये सब क्या कर सकते हैं, रेगुलर बेसिस पे कर सकते हैं.
हाँ, see, everything in a nomination is okay, like I said. But अगर आपको acne है तो it's a condition, you have to get it treated. If you have pigmentation, झाइयाँ जो बोलते हैं, it's a condition. आप वो भी करो and ये भी करो. I generally tell my patients, we are dry cleaners. We dry clean your skin. You wash your skin every day घर पे. So every 2 monthly get a dry cleaning done. That is how I
Right.
tell them.
All those association or जो
It
examples आप
connects.
quote कर रही हैं, that's really interesting. So we have Swati Sharma. Swati is asking, eating fish is great for one's skin. Is this true?
Yes, fish has the highest amount of omega fatty acids, but generally in India there is a very small category who are non-vegetarians, especially in Gujarat. So fish is an absolute best when for the non-vegetarians, but for the vegetarians, so we have walnuts, we have flax seeds, we have cocktail seeds. So dukhi hone ki zarurat nahi hai, and now we get even vegan omega. So we have a whole lot in the kitchen itself. So use your kitchen for enhancing your diet. Leave the skin to the doormat.
एग्जैक्टली. तो जो आप खाएंगे, जैसा
वो
खाएंगे, वो
दिखेगा.
भी बहुत इम्पोर्टेंट, वही आपकी स्किन पे दिखेगा. तो उसको स्किन पे लगाने की जगह उसको खाइए और डर्मेट को दिखाइए, डर्मेट से कंसल्ट कीजिए. Pramita Dubey है, पूछ रही है, how do I get rid of dark circles under my eyes? They are permanent.
Dark circles, again, lot of causes. So first you have to see your doctor, get your B12, iron and everything checked up. So कोई deficiency नहीं है, iron deficiency नहीं है, वो देखना पड़ता है. सेकेंड, जैसे कंप्यूटर वर्क हो रहा है, आई चेकअप कराना पड़ता है कि चश्मा नहीं है. थर्ड, हाइड्रेशन. सो कुछ समझ नहीं आ रहा है, यू गेट हाइल्यूरोनिक सीरम्स वेरी इजीली. सो हाइड्रेट करके देखो उसको हाइल्यूरोनिक सीरम से. Otherwise, then again there are a lot of procedures, eye treatments available for the dark circles. So see your dermat. This is max, and eat good. A good. I'm a very
Eat
big
good,
fan of,
rest
yes,
well,
yes,
yeah.
sleep well, eat good.
Yeah. Ishi Mishra है, पूछते हैं, what is the best method for maintaining a balanced skin?
In diet.
I think so, yeah.
See, for me, a glass of milk with a fistful of dry fruits in breakfast, 11 o'clock of fruit time, then normal Indian food जो अपना खाते हैं, दाल सब्जी रोटी, again a fruit, 2 different type of fruits, and go for seasonal fruits. Don't go for the cold storage fancy fruits. Go for simple जो लॉरी पे मिलते हैं ना, seasonal fruits.
Right.
And in between lot of chas and water. And evening take a high protein. Don't avoid wheat in the evenings. रोटी हम दोपहर में खा रहे हैं, go for mixed proteins, ज्वार, बाजरा, रागी, millets, besan, that ways. And if she's asking for the regime, we have already spoken of cleansing, toning, moisturizing.
Yes. Another very similar question, similar in the sense of skincare routine from Akash Mintru. Since I lead a very busy life, I need to keep my routine really simple. What are the absolute skincare basics?
टॉपिकली सी वो सुनने में इतना कॉम्प्लिकेटेड लगता है. सो बेसिकली आपने फेस तो धोना ही है. सो यू जस्ट वॉश योर फेस. यू कैन स्किप ऑफ द टोनर. यू गेट, आपको सनस्क्रीन ऐसे अवेलेबल होते हैं जिसमें सब इंक्लूडेड आता है, पूरा रेंज का ना. जस्ट पुट द सनस्क्रीन. रात को वॉश योर फेस एंड जस्ट पुट द सीरम. That's the simplest what you can do. 2 products.
Yeah, in that case, you just need a cleanser, a sunscreen, and a serum. और सनस्क्रीन जो है आप कितनी भी बिजी लाइफ लीड करो, आप अपने पास रख सकते हो. छोटे छोटे बॉटल्स में भी आते हैं. And keep on reapplying to be time that you would like it. It's really important. ये भी आपसे डॉक्टर जानना चाहेंगे कि स्किन को लेकर हमारे बहुत सारे वो रहते हैं. मतलब हमारी स्किन बहुत अच्छी दिखनी चाहिए, बिना डॉक्टर के पास गए, बिना अच्छा खाए सब लगा लेना, और इसलिए हम केमिस्ट के पास भागते हैं और सप्लीमेंट्स ले लेते हैं. तो या फिर विटामिन ई का कैप्सूल ले लेते हैं, टेक आउट स्क्वीज आउट सीरम और उसको लगाना. या फिर एक और बहुत कॉमन चीज जो हम करते हैं अपने स्किन के साथ, वो है हमको पता है कि विटामिन सी इज गुड. विटामिन सी इंटेक करने की जगह, खाने पीने की जगह उसको भी अपने फेस पे लगा लेते हैं. कई लोग तो लेमन काट के अपने फेस पे लगाते हैं. हाउ गुड और बैड these practices?
सी देयर इज समथिंग कॉल्ड एज अ पार्टिकल साइज. तो जो स्किन में जो पेनिट्रेट होगा वो सिर्फ माइक्रो मिलीमीटर ही पेनिट्रेट होगा. 1. तो जो विटामिन ई अगर कैप्सूल 1-2 रुपए का आ रहा है तो सीरम 1000 रुपए का क्यों आएगा? कॉमन सेंस. सो व्हेन यू break that capsule and put, it is technically not going to penetrate. So जो खाने का है वो खाना है, जो लगाने का है वो लगाना है. Then you buy proper thing. 1. Right. Lemon is a big problem because it is hardcore citric acid. I have seen burns, even white spots generated because वो lemon rubbing करते हैं. So again, it's always better to drink your vitamin C. आप vitamin C सीरम ले लो. So प्रेफरेबली जो लाइक आई एम टेलिंग, जो एक्चुअली जो हल्दी हम लोग लगाते हैं, जो खाते हैं, सॉरी, हम लोग लगाने का वो मेडिकली अलग आता है. तो वो एडिबल एंड टॉपिकल वो दोनों अलग चीज है. वो पेनिट्रेट ही नहीं होगा. इट्स अ वेस्ट ऑफ एनर्जी, टाइम एंड मनी, एवरीथिंग.
राइट. हो सकता है करते आ रहे हैं एक्चुअली गलत है, एंड वी आर एक्चुअली abusing our skin by doing all that. Of that, go and talk to a dermat. आपको लग रहा है कि नहीं अभी तो ठीक है, पर वो ठीक अच्छा बना रहे हैं और लंबे समय तक बना रहे हैं, प्लीज go and talk to a dermat. Doctor, as we are about to sum up and wind up the session, आपके कोई ऐसी बात जो आप शेयर करना चाहते हैं हमारे व्यूअर्स के साथ?
Maybe it's a repetition. Again, see your dermat. First check the dermat is a dermat or not, because now we are at mercy of a lot of people. So go to your dermat, follow them, give them some time. ठीक है, कुछ टाइम दो. बहुत टेक्नोलॉजीज अवेलेबल है. लोगों को ऐसा लगता है कि डर्मेट के पास जाएंगे तो बहुत एक्सपेंसिव होगा. ऐसा कुछ नहीं है. कोई भी जो बेसिक प्रोसीजर होता है 1500-2000 से ही स्टार्ट होता है जनरली. जो सैलून में भी हो सकता है. सैलून की जगह आप डर्मेट के पास करवा सकते हैं. मतलब ऐसा नहीं है कि हम लोग आप आओगे हम बोटॉक्स ही डाल देंगे, ऐसा नहीं होता है. सो बहुत सारे रिजुविनेटिंग प्रोसीजर्स रहते हैं. सो टॉक टू योर डर्मेट. आपके लिए कौन सा प्रोसीजर अच्छा है, आपके लिए कौन सा रेजिम अच्छा है, वो करिए. प्लीज डोंट गेट ट्रीटमेंट्स डन एट सैलून लेवल्स. हम इतना बर्न्स वगैरह देखते हैं. It should be जो जिसका काम है that should be done, and follow a good diet, a healthy lifestyle. For me it's 4 things: diet, exercise, sleep and skin care. So unless and until आप चारों करोगे वो ग्लो आपको नहीं मिलेगा. So stay beautiful, stay healthy.
Thank you so very much, Dr. Priyanka Sutariya. It was wonderful talking to you, and we really look forward for many more such sessions in coming times, and maybe हम sunscreen पे भी detail करें जैसा कि हम बात कर ही रहे थे. So thank you for your valuable time. Thank you so very much. And for more details for consultation, you may visit www.skinexperts.in. Thank you for an excellent participation. For more information and updates, skin health and care, Stay connected every week. Beautiful, spotless skin. We're also available on YouTube, Twitter, and Insta. Thank you. Good day. Bye.